In order to get started with mixing your HCG, you're going to need the following: an insulin syringe, a mixing syringe, alcohol swabs, bacteriostatic water, an 11,000 unit vial of HCG, and a sharps container. Go ahead and take the bacteriostatic water and the 11,000 unit vial of HCG out of the protective containers. Next, what we want to do is remove the protective caps from each of the vials. Easily do so by putting your thumb on it and just popping it off. Now that the protective caps are off each vial, you want to go ahead and take an alcohol swab and sterilize the top of each vial. You'll do so by rubbing the rubber gasket on the top of the lid with the alcohol swab. Next, our goal with the 11,000 unit vial of HCG is to mix in 5.5 milliliters of the bacteriostatic water. We're going to do so by using the 3 milliliter mixing syringe. Before we get started, this type of syringe has a removable needle. You always want to make sure that needle is on good and tight by giving the cap a good twist. After you twist and you ensure that it's on tightly, go ahead and remove the protective sheath. Now at that point, you always want to put in as much air as you're taking out fluid, and otherwise you want to equalize the air pressure. So what we're going to do is transfer 3 milliliters in first, then go back and transfer in another 2.5 milliliters. So at this point, looking at the needle, you're going to pull the plunger all the way back to a full 3 milliliters. Next, you're going to put the needle into the water and insert the air. Holding the plunger down, invert the needle and the water bottle so that the needle's pointing towards the sky, and then you'll see that very easily the water fills into the syringe. Pull back nice and slowly till you have a full 3 milliliters of water. If you see there's an air bubble at the top, you can pull a little bit past the 3 milliliters, push back up, and you'll see that the air bubbles are pushed completely out. Now that you see there's a full 3 milliliters of water in the syringe, go ahead and invert it and pull the needle out. What we want to do at this point is go ahead and put that 3 milliliters into the powder. Now, HCG powder is a very delicate hormone. When we put the water in there, we want to do so very gently. What I'm going to do is put the needle into the vial so that the water actually shoots against the inside of the glass, runs down the side of the glass into the powder. But also on that note, this vial is vacuum sealed with air. So when I put this needle into the vial, very quickly it's going to try to suck the water into the vial. Our mission is to hold this needle in a way and control the plunger and ensure that the water goes in nice and slowly. Simply put the needle in through the top, aim the needle towards the side of the glass, and very slowly you'll see that the water slowly fills the vial. Take your time, there's no need to be in a rush. Do so nice and easily. Once all the water is in there, go ahead and remove the needle, and we're going to repeat step 1. As I explained earlier, we need to have another 2.5 milliliters. So just like the first time, this time we're going to air the syringe back to 2.5 milliliters. Put that into the bacteriostatic water, insert the air, invert the vial and needle, and slowly pull back until we have a full 2.5 milliliters. Once it's filled, invert the other way, pull the needle out, and just like before, control the plunger, put it into the powder, aim it towards the side of the glass, and very slowly let that water slowly go down the side of the vial into the powder. Now that you're complete, go ahead and pull out the needle. You can set the needle down, and what you want to do is gently swirl the water around on the inside of the vial to make sure all the powder mixes. To do so, you want to hold it parallel with the ground, place it between the palms of your hands, and gently roll it back and forth. Sometimes this procedure can take 30 seconds to 1 full minute in order for all of the white powder to be fully dissolved. You'll see that after 20 seconds, sometimes there's still some white powder that sticks to the very center bottom of the vial. That's very common. Again, you want to take your time with it, Hold it sideways so the water splashes up against it, and you'll see that over time it slowly dissolves. So be patient and do this procedure for approximately a minute to 2 minutes if necessary. Perfect. At this point, you can see that there's no more white powder into the vial. The last step is to equalize the negative air pressure in the HCG vial. How we're going to do this is very carefully. You want to grab the original mixing syringe and grab the sheath that went over the needle. Very carefully, not poking yourself, put that protective sheath back over the needle. If you counterclockwise twist that needle, you'll see that it unscrews off of the syringe. Place down the syringe and very carefully use your fingers and pull the needle out of the protective sheath. What you want to do is poke that through the top, and you're going to hear the air pressure relieve. Perfect. At this point, dispose of the needle into your sharps container, and you can clean up and take the needles and syringes, the alcohol swabs. At this point, everything can go in the garbage. It's now time to do our first HCG injection. Please refer to the plastic container that contained your HCG vial. You'll see that on the label, it's going to tell you specifically what your dosage amount is. In this case, for the patient, the injection amount is 0.25 milliliters. In order to prepare for your first HC injection, again, you want to take another alcohol swab. Before any injection, you always want to sterilize the top of the vial. So gently wipe off the rubber gasket with the alcohol swab. At this point, you also want to clean the area on your body where you're going to be doing the injection. And with a subcutaneous injection, subcutaneous means that is done under the layer of skin into the fat. That is going to be in the belly area. The place to do the injection would be 3 to 4 inches to the left or to the right of the navel area. So at this point, go ahead and lift your shirt, find that area of skin, and clean off with an alcohol swab. Now, we want to prepare the needle to go ahead and do the injection. As the instructions said, we're going to do 0.25 milliliters, which is equivalent to the 25 mark on this needle. So first, go ahead and remove the protective cap from each end of the needle. And just like when we mix, whenever you take a liquid out of a vial, you want to equalize the pressure by putting air in. So you'll see with the plunger, pull that plunger back to the 25 mark. On this needle, you'll see that it counts 10, 20, 30, 40, 50. You have to eyeball to the very middle, and there are lines that equivalate, but go to the 25 mark, put the needle into the HCG vial, push the air in, and invert the needle and vial. At this point, very slowly withdraw down to the 25 mark. You'll see that sometimes you have some air that's stuck in the top of the needle. If you pull a little bit past the 25 mark, then push the plunger back up, it blows the air bubbles right back out of the needle and syringe. Once you're exactly at the 25 mark, invert the needle and HCG again, and take the needle out. Now when you do your injection, you want to make this very quick and very simple. An easy way to explain this is by holding the needle as if you were throwing a dart. Take this needle, put the needle up to the skin, and very quickly, one shot, straight in, very quick. Push in the plunger, remove, and you're done. Now that your HCG injection is complete, you want to go ahead and dispose of your dirty needle into the sharps container. You also want to clean up your work area by disposing of all the plastic caps, all of your alcohol swabs and wrappers, and also the used bacteriostatic water. Each water is meant to be a one-time use, so after you used it for mixing, you can go ahead and dispose of this. Also, now it's time to refrigerate your HCG. Always put the HCG back in the original container that it came in. You'll notice that this container is what has your name, your prescription, your dosage, and instructions. So a good idea is to go ahead and put this in the fridge, but put it towards the back of the fridge, maybe behind the milk where no one can get at it, where no one will accidentally knock it over, and you avoid the risk of it getting broken.